Hello and welcome to this British Psychological Society audio interview. I'm Wendy Barnaby and I'm joined by Dr Hamilton Fairfax, who's a psychologist in the Devon Partnership NHS Trust. And Hamilton, you've recently won an award from the Society for part of your practice. What I want to ask you about today is mindfulness and the way you've been using mindfulness to help clients who have obsessive compulsive disorder, OCD. So can I first of all ask you just to describe obsessive compulsive disorder for us?
Obsessive compulsive disorder, or OCD, is often characterised by very intrusive, often critical, nasty thoughts that come into somebody's mind without any volition or any control. Sometimes in response to these terrible and nasty thoughts, people feel the need to respond to them. Sometimes it's to neutralise the emotion that generates, because if you have a horrible thought that something bad could happen or you've done something bad, there's an automatic need to do something to reduce the levels of anxiety it creates. So that will be the compulsive behaviours, and that could be washing, that could be checking, sometimes that can be thinking rituals. And I think the definition of when something's an OCD and when it's not is when it interferes significantly with your life. So that if you are finding yourself delaying what you're doing, missing appointments, not being happy enough because your behaviour is interfering, that's when it's starting to think about it. But as it's most extreme, I often see people whose hands bleed because they've washed themselves so much, using bleach on different parts of their bodies. It becomes a really horrible thing if they're washing and checking, although it can't necessarily be not often as painful as that. You can see people checking for hours, many hours, and then there's no madness, there's no psychoticism about it. They're fully aware of how horrible that feels. And this is the other thing with OCD. People will often say, I know this is irrational, but I can't help but do it. And there's this sense of feeling something but not being able to control that feeling, and it's a further frustration for people.
And mindfulness?
Yeah, mindfulness it's an interesting question, because mindfulness is originally from Buddhism, and it's 3,500 years old, and it's recently been, I'd say in the last 20-30 years in psychology has started taking interest in it. But I think it's very important that we always quote our sources, and it comes from Eastern philosophy and an Eastern way of being. And when I talk about mindfulness with the clients and myself, we call it heartfulness. To reflect again that sort of embodied the importance of the body and the emotions as well as the mind, because bodies can become toxic if bad things have happened to them. So part of the practice is to really re-own our body.
And what does it mean to practice mindfulness? I mean, what do? Do you sit in a chair and sort of, what happens?
The beauty of it is it's an everyday thing. So you can be mindful and walking on the street, washing dishes, doing any form of activity. It's the essence of stopping and just being aware of what you're doing. So there's that glass of water. Pick up a glass of water, which I'm doing now, and just spend some time just slowly pouring, listening to the sounds, being aware all the time that this mind is chattering. Some people call it a mind monkey, like it's this sort of hungry, desperate monkey that jumps from branch to branch. That's our thoughts. So it's happening now as I'm doing this. I'm trying to pour this, and I've got a microphone in my face, and I'm feeling really anxious and worried. But now I can see the water, and I can do it, and that's a mindfulness thing.
And so you would actually get yourself to pour that water, would you, out of the bottle into the glass? Is that what you do?
We do it alongside our clients, absolutely. Or peel satsumas, or often people use raisins, but that's a bit too much. Go mindful walking, that's quite good. Making paper aeroplanes.
So pour the water in for me and tell me how you're doing it mindfully.
Okay, well, I suppose here's two examples. First off, here's what we normally do in our everyday life. I want a glass of water, so it's just going like that, slightly spilled. I'm doing that, I'm worrying, okay, we're done. Okay, but now I'm trying to do this mindfully, and already what I'm aware of is there's that thought of, okay, now you've got to do something, you've got to demonstrate something. There's there's another thought that comes along that, it better be really special and wonderful, it must be really impressive. And of course that's, in therapy, we'd try and find out with a client what that relates to. For me, it's worries about imperfection, inadequacy, so that's what's going on there. But so then I've distracted myself again. I've still not poured the water because I've gone off with that thought and thinking about the thought. So now I'm just slowly pouring it. And what I know is actually, okay, I can feel this bottle more now. And my thoughts are going off all the time because there's that microphone right in my face, but we're still doing it. I can feel, actually, this bottle is not cold. And the glass isn't clear, it's a slightly bluey liquid. I've still not poured the water, but that's all right, because what's also happening when you're doing mindfulness and heartfulness is being aware of non-judgment. So actually it's all right that I've not poured the water because I got interested in what the bottle looked like. And actually, what harm has that done? So I've still not poured the water. And my anxiety level's slightly less because I guess I'm caring less. So now the water's going in, and should I be doing it quickly? Now there's the other thoughts that are coming in. Am I doing it right? Am I doing this properly? Would a mindfulness practitioner think this is right? How do you pour a glass of water properly? Well, I don't think there is a way to pour a glass of water properly, so let's just pour it. And I don't know how long this has taken now to do that, and I've still not drunk the water. And I feel less thirsty, which is interesting, because I think that thirst was about anxiety, dry mouth, but now I've poured the water, it's sort of all right. And that's the sort of point, is getting to this okayness. I'm not guru-like, I'm not floating above, I'm not levitating, I'm not chilled out, I'm just sort of better, all right, in that moment.
So how can mindfulness / heartfulness help in this situation? How does it drill down to what's underlying these sorts of thoughts?
I think the thing about mindfulness, heartfulness, is it finds a way to help us understand the behaviours of our minds, because there was some very famous research in the 70s where some researchers in America stopped people in the street who were apparently normal and said, what's going through your head at the moment? And responses they got were things like, I could punch that person, I could rape my wife, I could kill that person, I could do something. So all these sort of free-floating, weird, inverted commas, thoughts were going on all the time, but they weren't attending to them. And people with, once you've had a shock, once you've had a horrible thought, people often have thoughts like, am I a paedophile? They might have seen something, and then the thought is, oh no, what does it mean that I'm thinking that I might be a paedophile? And that can spur off all these thoughts, and then some behaviours thinking, well, what if I am? Do I need to stop being around children? And these sort of meta ways of thinking about that initial worry can generate something else. So on one level, I think mindfulness is a way of, in the moment, being able to sit with the presence of an intrusive thought and tolerate it being there, knowing that perhaps you will do that compulsive ritual, but then you begin to have that break between the intensity of the thoughts and the compulsion to do something about it.
So it's just recognising, is it, that the thought is just a thought. It doesn't mean that you're going to necessarily do it, or you've got to do it, or there's something wrong with you for thinking it. You've just got this thought, that's all.
Yeah, absolutely. And I think, that's one way that it can work. And perhaps that, I think, will help some of the more traditional therapeutic interventions like cognitive behavioural therapy, where you sort of get in there and have other ways of doing it. But when a thought is so hot, it's so hard to resist. So it's finding another way that isn't just about challenging thoughts in a logical way, but just being with the feeling. And the benefit of a mindfulness, heartfulness, is it's a way of doing that without engaging in a logical debate.
Do you find that it is a better way of getting to grips with OCD than the traditional ways?
I don't think there's any need to say one's better necessarily than the other. I just know that this can be effective. I would just say, try it. Have a go. Don't worry about the expectations. It can be a very, very kind and gentle way of being with yourself. That example of the water, which probably is quite poor, is a way of how you can do it, because it's not some flaky thing. It's not a hippie thing that some people think, and it's not some really austere practice. It's just a way of being. You can do it all the time, and you might find yourself doing it anyway if you're fishing or playing sport or drawing or playing the guitar, anything like that. There's probably elements you may not call mindfulness or heartfulness that's there.